enter the room.
Hello, examiner. My GMC number is 00000.
Please begin.
All right. Hi there. You must be Del Morton.
Hi, doctor. Yes, I'm Dale.
Oh, nice to meet you. My name is Dr. Patience Katramtima, and I'll be the foundation year 2 doctor in this emergency department, and I'll be the one taking you through your lesson for subcutaneous injections, if I'm all right.
Yeah, sure. Really excited to learn about it.
Oh yeah. How's third year?
Oh, yeah, it's fun. I mean, there's a lot of studies, but I enjoy these clinical rounds.
Don't worry, you'll scale through. We all started there. All right. So, am I all right to call you Del through this teaching session?
Sure, Dale works.
All right. Yeah. So tell me, Del, what's your basic understanding of subcutaneous injections?
Oh, I don't really understand, the difference from any other normal injections. I just know that I've seen it being done a lot in clinics, especially for heparin.
Okay. That's okay. Where have you seen it being done? Was it in class or in the ward?
Oh, I saw it in the ward. Yeah, they were doing
Okay.
of
I understand. So, what are your goals? What do you intend to be able to do after this? How does it, how does it fit in your learning schedule?
Oh yeah, well, I feel that, if I manage to master it, I can use it a lot in the future, as a doctor.
All right, that's okay. Yeah, that's a good objective, actually. Have you ever, okay, I understand you said you've seen one being conducted, but have you ever assisted or given one a subcutaneous injection before?
Oh no, doctor, nobody's let me just yet.
All right, today, yeah, you will not be doing anything. You will just be listening and seeing, but feel free to ask any questions if there are any, okay?
Sure, doctor.
All right. So, you know, we're going to go through the steps. I just understand your basic knowledge of the skin. You understand the skin has 3 layers, right?
Yeah, yeah.
Yeah, so and this time you're dealing with a subcutaneous layer of the skin. That's where we are administering our medication via in injections, hence the name subcutaneous injection.
Oh, I see. Okay.
Yeah, so we use it to do a number of things medically. We could be administering vaccinations. We could be doing one common one. Have you seen one common one? What's the common one you've seen people use subcutaneous injections for?
Oh, heparin, I would say. I'm not sure.
Yes, you're right. It could be also used for insulin, actually.
Oh, okay, I see.
Yeah, it could be used for insulin too. And the technique is very easy to an extent that we also teach patients to use it at home. So don't worry, you're right. You'll be able to master this by the end of the session, yeah?
All right. Sure.
Yeah. Yes. So do you have any questions so far?
Oh, no, doctor.
Okay, that's good. So when you're doing the procedure, yeah, the first thing is obviously when you approach your patient, you have to be an approachable doctor, as we've all learned that you have to be a very approachable doctor. You introduce yourself, who you are, you check the patient details. If the patient is not verbal, you can check their hospital bench, their details, so that you don't administer the wrong medication to the wrong person.
All right, sure. Yeah.
Yeah, so we've checked the person. The next step now is to check the medication, because also incidents can happen where you can give the wrong medication. So medication, to check the right type, to check whether it's still viable, so that's your expiration date, and to just physically check. Sometimes you can just lift your vial in the air to just see if anything is wrong with it. Yeah,
Okay, yeah, sure.
I hope you're understanding. If you have any questions, please feel free to ask. Yeah. So now we go to the procedure. Always explain a procedure to a patient so that they have a basic understanding of what is being done to them. They don't feel violated. Yeah.
Yeah.
So for you, like if in this case, of course, you would explain this like, I'm going to be administering a certain, whatever kind of medication you're going to give them, using an injection, but we call this one a subcutaneous. It's not supposed to be painful. You might feel a sharp scratch. Okay?
Yeah, yeah.
Yeah. So of course, before we go on to inject the medication, there are common sites where people put this medication.
Mm-hmm.
Yeah, most of the times it's the thigh, the buttocks, the arm, or the abdomen. And would you have any knowledge why people do that? Why these sites are very common for administration?
Um, yeah, no, I've seen it getting rotated a lot.
2 minutes remaining.
Yeah, so you repeat it a lot because the more you put you inject and you do injections on the same side, there's lipodystrophy. So when lipodystrophy happens, there's going to be reduced absorption of medication, and because we want this is a slow release medication if you're putting it in the subcutaneous area. All right. So after doing your procedure, I hope you've understood. Yeah.
Okay, yeah.
Yeah, so before doing your procedure, make sure the area is clean. You check the area if there's any tears, any rashes, any reactions. If it's clear, you go on, you tell the patient, sharp scratch, you inject your medication at a 45-degree angle, right?
Okay, okay.
Yes. And also before you obviously do your injection of the drug, you would have checked if they have any drug allergies to make sure you're not going to cause an anaphylaxis, and if any bleeding disorders. And after that, you discard your needle into the sharpstein and you put your clean gauze on the area. Okay.
Mhm. Okay,
All right.
okay. Yeah.
Yes. So I don't know at this point, do you have any question? I'm happy to answer you.
Nope, no questions.
All right, just in case I need to go quickly or I'm called, I'll just give you my contact for you to have. If you have any questions in the future, you can always feel free to contact me. I'll be happy to teach you and give you feedback. Yeah.
Yeah, that works.
Yeah. Because so there's some learning materials. I can give you a QR code, or I can give you leaflets. It depends if you've gone paperless. You know, most people have gone paperless. I can give you a QR code. You can read this information in the future on your lesser date.
All right. Yeah, that could be
All
helpful.
right.
Mhm.
All right. If you have any questions, they're not areas I haven't touched.
Um, so doctor,
Move on to the
All right.
next station.
Thank you.
what are contraindications of giving a subcutaneous injection, doctor?
Uh, the indications would be a medication we want to have slow release,
Contra
not fast.
the contraindications of a subcutaneous injection. When is it contraindicated?
Not sure, doctor.
Yeah,
Sorry.
that's right. So basically, any areas of infection, inflammation, lesions. Yeah.
Okay, yeah. Because we did the checking, yeah. So it'd be contrary, yes.
Make sure you inspect the area before you actually give the injection. But yeah, awesome. That was great. That was great. Let's quickly
Okay.
yours. But definitely one important aspect again you're missing is to gauge understanding of what you've already taught, right? So you mentioned a lot of good points that why do we rotate the area? So we just recently discussed why we rotate the area. Could you tell me a little bit about what you understood again? Right.
Okay.
So
Yes.
the understanding, because mostly in these cases, the student will give you a wrong answer. All right.
Yes.
So the examiner wants to know how you correct these misunderstandings.
Okay.
So that is like your entire approach to teaching. You know, if the person that you're teaching to understands something incorrectly, how do you rephrase, paraphrase to make sure that they understood it properly? You know, by just
Okay.
asking, have you understood? Yeah, that's good. But also the good best way or the the most standard way of knowing if a person has understood something is by testing their knowledge, right? Ask a few questions, right? And they will make a mistake. So, gently tell them, saying that it's okay, it's a relatively difficult topic, don't worry about it, but this is not exactly right, and correct the answers, be encouraging. So those are a couple of things that you are, the examiner is actually trying to test you on, right?
Okay, doctor. Yeah.
All right, then let's quickly look at the checklist. One moment. Yep, I have it here. All right. So, well, yeah, there's been some improvement. Let's go through each point. So, you confirm the name, you confirm the year. That's good. A little light conversation, gauge understanding how far, do you, how much they know about subcutaneous injections, and, what is their, purpose of learning. Ask why the student wants to learn the skill and how it fits into his current goal. I think I'll give you a pass. I mean, I'll give you a yes. You actually asked me this. Ask if the student has ever seen or assisted with a subcutaneous injection. Good job. Ask Dave to summarize key points at intervals to gauge understanding. So this is something that was not done. Check comprehension periodically by asking the student to summarize or repeat important points using open questions to assess the depth of their understanding. Can you tell me what you know about, the common injection sites that we just discussed, right? So this is something that was not elicited. Even misunderstanding. So you never, by not asking me any questions, you never gave me an opportunity to, give an incorrect answer. So that's also something that the examiners are testing. If the student does give an incorrect answer, how do you, respond to that? How do you make sure? Do you just, don't even acknowledge that it's wrong, or you just move on with the teaching? Or would you actually acknowledge it and correct it? So that is something that they are trying to see if you are able to do. All right, so definitely do incorporate that in your teaching. Set the learning agenda, explain that you will go through the preparation, technique, safety, and precautions. So that's one good way to actually start the sessions. Like, okay, so you want to learn about subcutaneous injection, give an agenda, give an overview of everything that we're going to talk about. And just in case if you're not able to cover this, don't worry, here's my number. We can have another where we can, talk some more about this topic or any other topics if you're interested, right? So definitely mention that, right? Give an agenda. So that was something that was lacking. So because at this point, if you didn't get time to go through all the topics, at least the examiner would have an idea that this is the depth that you would go into with regards to this topic. Right. So definitely, give like an overview agenda of everything that you want to talk about in this session, in this teaching session. Right. And then set the scene. Today we'll go through the steps of performing a subcutaneous injection. If you have any questions, feel free to ask. Are you ready to start? Right. Explain the importance. Subcutaneous injections are widely used for administering medications such as insulin, heparin, certain vaccines, and palliative medications, making this technique essential in many clinical settings. That was good. You mentioned that. Equipment preparation, all the equipments that you would be requiring in order to perform this task, right? So talk about everything that you would be needing in your vicinity, so as to perform this in an aseptic proper manner, right? Medication check, verify medication name, expiry date, dose, preferably with a witness. I'm going to give you a partial for this. You actually did this. Pre-procedure check, confirm patient's name, identity, and check for allergies. Check for allergies is very important, just in case that needs to be done. Right? Even though you are confirming the person that you're giving it to, you just have to make sure that they are not allergic to, anything that might be relevant to the medication that you're going to be administering. Right? Because a lot of vaccines, if you're administering a lot of vaccines, they contain, they are contraindicated in certain different types of allergies. Right? So just keep that in mind. Inspect the site for appropriate Inspect and select an appropriate injection site. Describe the proper injection site, abdomen. Also, I'm going to give you a partial as well here as well, because you did mention different sites where we give it, but make sure to tell them that, you know, the sites at which you're giving this, it needs to, you know, not have any scars, any active inflammation, any active infection, right? So make sure to choose the right site, right? Clean the area, pinch the skin, inject it at 45 to 90-degree angle, and apply gauze, right? I think that, yeah, that was right. Explain post injection steps. Withdraw needle, apply gauze gently, and safely discard the sharps. Yeah. Discuss precautions. Avoid inflammation, inflamed or scarred area. Rotate sites. Maintain aseptic technique. Describe potential complications of poor site rotation, like lipodystrophy, and when and why they matter, right? I'm going to give you a partial for that one. Proactively offer your contact details for follow-up learning or to schedule another teaching session. Yeah. Offer the student relevant leaflets or direct them to trusted online resources. That was also done, so good job on that. Use simple language. Do not use any technical words, you know, without explaining them. So I'm going to give you a partial away because you mentioned lipodystrophy, right? So explain that. Explain what lipodystrophy is, right? There will be destruction of the fat tissues at which you at the site where you're administering the injection, right? So such prolonged destruction can actually end up causing hypertrophy or even sclerosis, right? So in order to avoid that, we actually rotate the sites. Encourage questions. Feel free to ask any questions anytime. Be supportive. It's normal to feel a bit anxious about this procedure. I'm here to help. Use simple language to explain concepts, active listening, and provide constructive feedback. Suggest additional resources for further learning. So definitely. Good job. Yep. Yeah, management would have taken a little bit more. Yeah, you could have explained a few more things for management. Otherwise, yeah, I'll give you a tick for language as well, because if you use jargon, you would get ticked for language without explaining. So you make sure that if you do use any medical or technical terms, you follow it up with an explanation in layman terms. That is very important. All right. All right then.
Please like and subscribe to Turing Med School. Good luck with your preparation.